ED occurs when a man can't get or keep erection firm enough for lovemaking. ED can be a sign of physical or psychological condition. It can cause stress, relationship, or low self-confidence. Whether you currently suffer from ED or you're hoping to sidestep this condition, try these tips to overcome ED for better health and a better love life. Hey guys, welcome back to my channel. Today we are dealing with erectile dysfunction, but I'm going to be using ED more often so I don't say erectile dysfunction too often. Alright, what prompted me to do this video was based on the kind of videos that I do. I get people asking me tons of questions. So I got this question from a subscriber, how to take care of it. And we always think of natural remedy. So I'm not going to be diagnosing any drug that you are going to take that would help cure ED. Alright? What I'm giving you here is the inquiries that I've made. Whatever information you get here, it is to help with whatever you have, but it is based on natural remedy. So you might be wondering, why is she doing this topic? Is she a doctor? I am no doctor. I have medical practitioners in my house, like I have many of them. So I made a lot of inquiry. So I decided to bring the good news to you guys. Okay, let's get on with this video. The main symptom is a man's inability to get or keep erection firm enough for lovemaking. ED is common in people who are older, have health conditions like diabetes or high blood pressure, people who have had an injury to the spinal cord, manhood or pelvis, take medications like antidepressants or blood pressure medication, have anxiety or stress, are overweight, and people who smoke. The treatment of ED depends on its cause. It may include certain prescription medications, a vacuum device, or even surgery, but lifestyle changes or other natural treatment can also help improve ED. There are many natural treatments for ED. They range from lifestyle changes like modifying your diet and exercise to getting mental health or relationship counseling. It is best to talk with your doctor before trying a new treatment on your own. They can best help to identify the cause of your ED and recommend the best effective ED treatment option, whether conventional, natural, or a combination. Eating a balanced diet may help maintain sexual function and decrease the risk of ED. Consume less red or processed meat and primarily eat fruit, vegetables, legumes, nuts, fish. These foods are important for your overall health, so helping maintain or improve sexual function, as well as it's a win-win. Physical activity may help protect against or improve ED. It may be particularly effective if the ED is caused by obesity, inactivity, or cardiovascular disease, among other conditions. Do moderate to intense aerobic exercises for 40 minutes a day, 4 times per week for 6 months. Will help reduce ED. This will include exercises like running, brisk walking, swimming, skiing, and even bicycling, but take it easy on the bicycling or cycling, I don't know. Physical activity helps improve blood vessel health, lower stress, and raise testosterone levels, which can all help with ED. It is important for your overall health to get enough sleep each night. Sleeping regularly may improve ED. Not getting enough can lower your testosterone levels, which may contribute to ED. Sustained lack of sleep is also associated with conditions that are related to ED, like diabetes and high blood pressure. Your weight may be another factor in ED. ED is significantly more common in men who were overweight or had obesity or a larger waist circumferences. If your weight is contributing to your ED, exercise and balanced diet can help you lose weight and improve ED. In some cases, ED results from a combination of physical and psychological issues. These may include fear of failure, religious beliefs, and sexual trauma, among others. In turn, ED can lead to additional mental health issues, including emotional distress and lower self-esteem, which then can further worsen ED. Therapy may help address these issues to improve ED. Mental health issues like stress and anxiety are often linked to ED. Chronic stress may affect testosterone or cause sleep deprivation, which may contribute to ED. Stress management program alongside ED medication is effective for improving ED. Drinking light to moderate amount of alcohol is associated with a lower risk of ED. On the other hand, regular and high consumption might significantly affect ED, smoking cessation. Smoking is another behavior that likely contributes to ED. This may be caused in part by smoking damaging blood vessels, preventing enough blood from reaching the manhood for an erection. Smoking may also reduce the availability of nitric oxide in the body, which is needed to cause the involuntary muscle relaxation and increased blood flow that play a role in erection. More frequent smoking is associated with an increased risk of developing ED, as well as more severe ED. Some damage from smoking may not be reversible. It is challenging to quit smoking, but there are many resources available to help. Stopping smoking has the potential not only to help ED, but to benefit other areas of your health. Lifestyle changes may be an effective natural remedy for ED and improve your overall health. But many changes like losing weight, quitting smoking, or eating a balanced diet may be difficult to achieve. It may also take time for natural treatments to have an effect. Some people, depending on the cause of their ED, may not show improvements without medication or other treatments. It is helpful to work with your doctor to find a treatment that works for you. What is the most effective treatment for ED? The most effective treatment for you depends on the underlying cause of your ED. While lifestyle changes tend to be safe while improving ED, they may be difficult to achieve. Oral medications are another primary treatment for ED, but they don't also work for everyone. If the ED is caused by a lifestyle factor, health condition, or a medication you're taking, it may be possible to reverse it by addressing it with a natural remedy. Surgery may also cure ED in some cases. On the other hand, medications treat ED symptoms and can improve ED, but do not cure the condition that is causing it. ED is a condition that affects both partners. Partners engaging in the diagnosis, education, and therapy together may be more effective for improving ED and achieving more satisfaction from love life. Depending on the cause of your ED, natural remedies may not be effective. If this is the case, your doctor may prescribe medication for ED. ED is a common condition that can affect men's confidence, relationships, and quality of life. The most effective treatment depends on the cause of the ED. Still, natural remedies may help improve the ED and your overall health. It's best to talk with your doctor about your ED to identify treatments that are most likely to be helpful. It can also be beneficial to approach the condition together with your partner. Remember that treatment, particularly lifestyle changes like losing weight or getting more exercise, may take time. Work with your doctor to find the treatment or a combination of remedies that will work best for you. I hope this video answered some questions and it was quite helpful. If it was, please do not forget to give this video a huge thumbs up, hit on that subscribe button, turn on the notification bell so that YouTube will notify you whenever I post new videos. Let's continue to gist in my comment section. What do you think about ED that I didn't talk about? What is the best way you think that ED can be taken care of that I didn't talk about? Let's continue gisting in my comment section.